In this case, we see an incidental finding on a study performed to evaluate the patient's primary clinical issue of a right parafalcine meningioma. There is linear vascular enhancement extending from the left superior frontal gyrus inferiorly to the left thalamostriate veins, compatible with a developmental venous anomaly. A corresponding flow void traversing the left frontal lobe is additionally seen on the T2 sequence. Although not seen in this case, these lesions are frequently seen associated with cavernomas. This represents a common incidental finding. An attempt at removal can otherwise lead to hemorrhagic infarction. Thrombosis of the draining vein may lead to hemorrhage, but the risk of intracranial hemorrhage is higher with a concomitant cavernous malformation.